My name's Naomi van Hest, so I work for a health economic consultancy. I lead a team of about 25 to 30 health economists and statisticians, and I'm studying the executive MBA in healthcare at UCL part-time. I think it's something that I didn't necessarily have the answer when I started it, but I think as I've gotten into the flow of it, I've got a better idea of what I was actually trying to get out of it, and I think a lot of it is to do with learning to be a better manager and leader, and surrounding yourself with people who also aspire to be like that. And I think for me, coming from a non-clinical, non-scientific background but more business background, is just learning about how I can, while working in the healthcare sector, still bring my own mark to healthcare and improve patient lives, improve healthcare outcomes, but coming at it from a very different perspective, which is what I'm hoping to achieve by doing the programme. One that I have found so far is just really the value in listening to other people's opinions, and I know that sounds quite simple and something that we should be doing in the workplace every day, but I've really found that just from the range of people that are in the course and how diverse different people's perspectives are, that actually just taking a second to not think about how you would answer the question, but actually listening to how someone else is answering that question has been really valuable, particularly because there's just a really amazing cohort of people. There's people with signed clinical backgrounds, there's surgeons, there's people who maybe have backgrounds a bit more similar to me, and we all interpret the same question in a very different way, and I found that really valuable. I think the other thing that I found I don't know if it's like a skill or just a reminder as well, is that obviously like in a program like an MBA or an MBA, there are so many opportunities in front of you. I think a big part of the program is about creating opportunities, but I think something that has been a really good reminder for me in the program is that you still need to be the one responsible for taking those opportunities and acting on things and really making the most out of it. And I think that's a skill that I'm still trying to do my best, I guess. I don't think I've nailed it, but I think that's something that you're really reminded of every day, that you can really see the difference between people who, see this happening, see that happening and actually act on it and make the most out of it, and those who are, I guess, a bit more passive about it. I think the opportunity to connect with people who are very similar to you in a lot of ways, in that obviously you've all chosen to do this programme. I think when you talk to each other, you have fairly similar values and you want to achieve the same things in terms of, people are here because they want to improve healthcare, they want to improve patient outcomes, but coming at it from such a different background, like I mentioned earlier, I think that is really, really great, and I think that is something to definitely look forward to. And in particular, I love the flexibility of the programme, that we're able to do it while we're working full time, that we're able to capture a pool of people who don't just live in London, but myself, live outside of London, and if it wasn't in-person programme 24/7, I wouldn't have been able to do it. So the opportunity to do it all remotely, but then make the most out of this, the in-person weeks and kind of catch-ups outside of that, I think is, kind of forming that connection is, definitely something to look forward to. I think the direct applicability to healthcare was, 100% the deciding factor for me. I, in previous years, had kind of looked at MBAs on and off. I knew I wanted to do a bit more in leadership and develop those skills, but I just looked at the programmes and I thought, I just don't see how this is applied. It felt a bit waffly. It felt kind of, I don't know, maybe a bit airy-fairy. I just couldn't quite see its relevance to what I specifically wanted to do. And it wasn't until I saw this programme of applicability to healthcare, when you're reading through the modules and you're like, great, finance, economics, marketing, you're learning about innovation, but everything is through the lens of how does this apply to the healthcare, and healthcare as an industry and a sector, whether you're in the UK or globally, is just so different to other sectors, and you can't apply the same approach and principles across all sectors. So I think the opportunity to not only do all your assessments and networking through this lens of healthcare, but also be talking to experts and organisations that all have a stake in healthcare as well, I think is just really valuable if you know that you do want to work in healthcare. So I think that for me, it's an obvious unique selling point of the programme. I know I want to work in an environment that makes a meaningful difference. Most likely with my background it will be an indirect difference to patients and healthcare outcomes, but that's important to me. I want to be able to see the impact of my work, and I want to do that alongside a team of people that feel motivated in the same work. And I think that for me, in whatever future work I'm looking for, will be really important.